Good afternoon and welcome back to a conversation about food labels with the Food and Drug Administration panel for the Courage at Congress 2021 Advocate for a Cure Virtual Fly-In. I'm Steve Dannon, Senior Vice President of Public Affairs and Communications for FAIR. We are so very fortunate here today to have Dr. Susan Mayne, the Director of the Center for Food Safety and Applied Nutrition with the Food and Drug Administration, joining us here today to discuss about food labeling. Susan, welcome.
Hi, Steve. Thanks. It's nice to be here today with you.
Yeah, Dr. Mayne, it's been an honor really to work with you and your staff for the past 18 months, and we're really delighted to have you here today and really appreciate you taking time out of your busy schedule to join us. We would like to get to know a little bit more about you and how you got involved with science and public health. So we would love for you to share with our audience a little bit about your background. And I noticed that you spent nearly 3 decades at the Yale Schools of Medicine and Public Health. How did you get involved with science and public health?
So I guess I'd say, Steve, I always wanted to be a scientist. I knew that from my early days. I majored in chemistry in college, where I was at the University of Colorado. That's my home state. I grew up in Colorado. I had a strong personal interest in food and nutrition, and so I decided to put all that together. And so I did doctoral work in nutritional biochemistry. After that, I accepted a 1-year postdoctoral fellowship at Yale because I wanted to learn epidemiology so I could do human research. And that 1 year turned into 3 decades, as you noted,
Wow.
that I spent time at Yale while also raising a family.
Wow, it's really impressive. So what led you to want to lead the FDA back in 2015?
I always enjoyed doing original research, but as my career advanced, I had opportunities to serve in advisory roles where you really translate science into policy. So, for example, I served on the Food and Nutrition Board of the National Academy of Sciences for 7 years, and I found it really gratifying to see scientific knowledge translated into public health advances. I was approached by the FDA in 2014, and despite the fact that I held a tenured job at Yale, I really couldn't turn down an opportunity to use my scientific knowledge and my leadership experience to help serve my country. And as we like to say at FDA, it is an honor and a privilege that we do not take lightly.
No, absolutely. And now with the first 100 days of a new administration, how would the Biden administration kind of impact your work over at the FDA?
I'd say, we really look forward to working with the Biden administration and engaging on all kinds of key issues that impact public health. As can be expected, the administration is hard at work to address the COVID-19 pandemic. So I can't predict right now how CFSAN's work will be affected. However, we fully expect that public health will be a high priority, particularly the importance of addressing health disparities. And we know that underlying health conditions, which may be nutrition related, can increase the risk of severe symptoms and death from COVID-19. So I anticipate that there will certainly be a renewed focus on nutrition and food labeling with the Biden administration.
No, absolutely. And we really appreciate all the work that you and your team have done around the volunteering labeling of sesame and feel like it's a step in the right direction. What do you think the next steps of the rulemaking process will be with compliance look like for food manufacturers? I know, as you know, we've introduced, the Congress has introduced the FAST Act in the House and the Senate, but what do you think the rulemaking process will look like for the compliance aspect with food manufacturers?
So thanks for asking about our actions on sesame. We received a lot of very positive feedback on the guidance to encourage the voluntary labeling of sesame. As you said, it's a step in the right direction, but we really are hoping that we can do more. And so first, we are watching the FASTER Act and the legislation with interest, and we look forward to implementing it if Congress passes it. At the same time, we are working to identify criteria that can be used to assess the public health importance of allergens other than the major food allergens identified by FALCPA, the Food Allergen and Consumer Protection Act. We need to prepare for the likelihood that we will need additional controls, including manufacturing controls and labeling for allergens beyond the Big 8. We need criteria, even if the FASTER Act legislation passes, because in its current form, the only allergen that it addresses is sesame.
No, that's very true. And I know if FAST Act does pass, it directs the Health and Human Service Secretary to come back to the Health Committee within 18 months And obviously there's a process of timeliness and transparency and an evidence-based modification to add future allergens. What do you think that process could look like?
Well, I think the process must be science and risk-based, and that's the first most important thing from our perspective. And so what we are working on is identifying criteria that can be used to assess the public health importance of allergens other than the major 8 food allergens for which additional controls may be needed. We need those criteria for our staff to determine if other allergens should be addressed and for responding to citizens' petitions. Basing our actions on specific criteria will make the process transparent as well as evidence-based.
No, absolutely. And again, our work with you and your team at the FDA has been absolutely phenomenal. A lot of good communication back and forth. But shifting to another topic, last May, as you may remember, we spent a lot of time together as a temporary labeling guidance was issued during this pandemic, and it raised some concerns in the food allergy community. I know we're in a much better place today than we were last May. And it appears with the vaccination distribution and food supply issues, there shouldn't be too much of a concern. But what do you see as the future of that guidance? And do you have a sense where it might be lifted and how it may be applied?
Great. Thanks, Steve, for that question. The COVID-19 guidance documents that we issued are in effect throughout the public health emergency. We don't have a stop date for them to no longer be followed since the food supply situation could still change as the pandemic changes. As you know, we have had upsurges in cases of illness following the holidays. Now we have seen some new variants that could affect the severity of the pandemic. So we're very encouraged by the trends we're seeing, but we still could have food supply disruptions. I will also note that President Biden on February 24 signed an executive order to look at supply chain challenges, and that includes food and agriculture supply chains. We aren't aware that anyone has had to use these labeling flexibilities so far. We know that labeling on food packages is not only critical for those of you in the allergen community, but it's important for all of us. So many consumers use the nutrition facts label and the ingredient list to choose foods for themselves and their families. Personally, I'm a label reader. I constantly read labels when I'm in the grocery store and when I'm ordering food online, and I've done that for years before coming to the FDA. So we certainly understand the importance of making sure that information is available and accurate.
You know, it's interesting because in our food allergy community, a lot of people, the average time is spent 3 to 5 minutes reviewing a label. And I know there was a lot of individuals were very excited that you were going to join us today. And we actually had a question for someone with that had a question really for you is during this pandemic, you know, we are cooking a lot more, we're ordering more groceries to be delivered at home. We're supporting our local restaurants through takeout and delivery. What is the process of labeling or making it easier for restaurants to advise if their bulk foods of like deli meats, condiments, and other products contain allergens? And as one of our advocates found out, the deli meats that included hidden tree nuts. What could they do to be a little bit more aware?
Yeah. So in March, early in the pandemic, we provided flexibility for restaurants and food manufacturers to be able to sell at retail food that was not labeled for that purpose. For example, restaurants may have purchased ingredients that they could no longer use to prepare restaurant food and instead wanted to sell that directly to their customers, as you noted. We indicated we would not object if a packaged food lacked a nutrition facts label unless it was making nutrition claims. But we clearly stated that products still had to carry allergen information, anything required under the Food Allergen Labeling and Consumer Protection Act, in addition to other essential information. So allergen labeling is still required for FDA regulated products during this pandemic, and that was not part of the flexibility that we granted last March.
Now, Dr. Mayne, thank you so much. And we really can't thank you enough for joining us here today and really for your leadership and dedication to helping the food allergy community. I would love to give you an opportunity if you have anything you wanted to share with our audience. I know we have a lot of young teenagers who are interested in maybe pursuing a life of science and nutrition, and any advice that you may have for them or any future FDA projects that you have in mind.
I think what I'd like to do is just reassure your community that we place great importance on protecting consumers from food allergens. And we are addressing food allergens from many different angles, from prevention and labeling and enforcement and research and education and outreach to protect food allergic consumers as much as we can. For example, while the Food Allergen Labeling and Consumer Protection Act greatly improved our ability to inform consumers about the presence of the 8 major food allergens, we know that there are other allergens other than those big 8 that can cause problems in sensitive individuals. And I've met with many of the families who are struggling with some of these issues. That is why we are monitoring the food supply to determine if other substances pose a significant public health risk. And our guidance on the voluntary labeling of sesame is an example of an initial action that we took. I also want you to know that enforcing current requirements is a very important priority for us. Undeclared allergens have been the #1 leading cause of Class 1 food recalls for at least the last 3 years, so we know it's a problem. I personally get email notifications when we have food recalls, and I can tell you there are far too many for undeclared allergens. About a year ago, we stepped up our enforcement efforts by sending warning letters to food facilities that have manufactured and distributed foods with undeclared major food allergens that resulted in Class 1 recalls. We also, for the first time, sent a warning letter to a retailer, in this case Whole Foods Market, for repeatedly failing to have appropriate quality controls, leading to some of their products being sold with undeclared allergens. I view FAIR and other related groups as key stakeholders for us, and we certainly look forward to working with you as we work on further progress in this area.
Dr. Mayne, thank you so much again for joining us today. Thank you.
Thank you. It's my pleasure to be here with your folks.